Welcome to the deep dive. Today we're tackling something we all know, maybe a bit too well.
The common cold.
Exactly, the adult common cold. And you might think, okay, runny nose, sore throat, what's there to discuss?
Right. But actually, there's a surprising amount under the surface.
And we're digging into it using insights from Up to Date, a great clinical resource.
Very reliable.
Our mission today, go beyond just the sniffles, pull out the really key stuff, the interesting bits about colds, and, keep it focused.
Sounds good. Because, yeah, it's easy to just wave it off as minor.
But the impact? It's
Yeah.
not so minor, is it?
Not at all. When you look at the bigger picture, the scale is, well, pretty staggering, actually.
Okay, so let's start there. Medically speaking, what is a cold? Because I think we lump a lot of things together.
Yeah, that's common. So fundamentally, it's not one single thing. It's a syndrome,
A syndrome.
meaning a collection of symptoms. And these symptoms can be caused by loads of different viruses, over 200 subtypes, actually.
Wow.
And it's specifically a mild upper respiratory viral illness. That mild and upper respiratory part is key.
And distinguishing it from other things is important too, right?
Crucial. It's
Well,
not
yeah.
the flu. It's not strep throat that's pharyngitis. It's not acute bronchitis, not a bacterial sinus infection, acute bacterial rhinosinusitis,
Okay.
not allergies, which is allergic rhinitis, and definitely not whooping cough or pertussis. They're all separate deals.
Over 200 viruses. That explains why we seem to get them so often. And you mentioned the impact, the economic side.
Oh, it's huge. Think billions of dollars every year just in the U.S.
Billions from colds.
Yep. Billions in treatment costs, doctor visits, medications, and that's just the direct cost.
What about indirect, like missing work?
Even bigger. We're talking potentially over $20 billion lost because people can't work or aren't productive at work.
20 billion. Okay, now I see why so much research money goes into this. Tens of millions of lost work in school days, you said.
Exactly. It adds up incredibly fast. Colds are a major reason people call in sick.
It really puts it in perspective. So who are these viral culprits? You said over 200. Any main players?
Definitely. The biggest group by far is rhinoviruses.
Rhino, like nose.
Precisely. They cause maybe 30 to 50% of colds. And get this, there are over 100 different types of rhinovirus alone.
100! No wonder we keep getting reinfected.
Exactly. Then you've got coronaviruses, historically, maybe 10, 15%. Obviously, SARS-CoV-2 changed that landscape, though the variants now tend to be, less severe generally.
Right. Who else is in the mix?
Well, there's influenza viruses. They can cause cold-like symptoms, maybe 5, 15%. RSV, respiratory syncytial virus, about 5%. Parainfluenza, also around 5%.
So quite a few regulars.
Yeah. And then others like adenoviruses, they often cause more sore throat, maybe fever, sometimes lower respiratory stuff too. And enteroviruses, which are often actually asymptomatic or just cause a fever.
The key thing I'm hearing is you can't tell which virus you have just by how you feel.
Pretty much impossible for the average case, yeah.
Yeah.
Symptoms overlap a lot.
And we do get reinfected, but it's usually milder the next time with the same virus.
Generally, yes. Subsequent infections tend to be less severe. Why exactly? We don't fully know, but rhinovirus variation is a big part of the puzzle.
Okay, so we know what causes it. Lots of viruses. How do they actually spread? How do we pass these things around?
Well, the evidence points really strongly towards hand-to-hand contact.
Really? More than coughing and sneezing.
It seems to be a major route. Studies have shown it again and again. There was one famous study using iodine disinfectant on hands, significantly reduced illness rates in the group that used it.
Huh. How long can the virus live on skin?
Up to 2 hours, potentially. So yeah, transmission risk depends on how long you're near someone, how close, and how much virus they're actually shedding.
Makes sense. So wash your hands.
Absolutely key. Then, of course, you have droplets. Small ones, aerosols from coughs and sneezes that can hang in the air,
Okay.
and larger droplets from closer contact. Plus, contaminated surfaces, fomites.
Right, touching a doorknob or something.
Exactly. Rhinoviruses can survive for hours on some surfaces. Interestingly, though, not so well on porous things like tissues.
That is interesting. So using a tissue is still good.
Yes, proper disposal and then hand washing is crucial. And using virucidal disinfectants on surfaces helps.
Virucidal, not antibacterial.
Correct. Antibacterial cleaners do nothing for viruses.
What about that myth, or maybe it's not a myth, about airplane air? Recirculated air making you sick.
Yeah. Well, one study actually looked at this and didn't find a higher rate of colds on planes with recirculated air versus fresh air.
Really?
Yeah. Which kind of indirectly supports the idea that hand contact might be more significant, at least in that setting.
And saliva. Kissing.
Generally not considered an efficient way for most cold viruses to spread.
Okay, good to know. So if you do get sick, when are you actually contagious? When are you spreading it the most?
Good question. With rhinovirus, peak viral shedding, releasing the most virus, is often around day 2 of symptoms.
Day 2. Okay.
Overall, for many cold viruses, shedding often peaks around day 3, and that usually lines up with when your symptoms feel the worst.
But you're not instantly safe after day 3, are you?
Oh, definitely not. You can still shed lower levels of the virus for, believe it or not, up to 2 weeks.
2 weeks. Wow.
Yeah, studies have even infected volunteers using nasal washings taken from someone 5 days into their cold.
So be mindful, even when you're starting to feel better.
Absolutely. Now, thinking about who gets colds, are some people just more prone?
It feels that way sometimes.
Well, exposure definitely matters. Being around kids in daycare is a big risk factor.
Tell me about it.
Uh-huh. And at-home caregivers also tend to get more colds.
Okay. What else?
Psychological stress seems to increase your susceptibility.
Stress makes everything worse, doesn't it?
Pretty much. But on the flip side, moderate exercise actually seems to decrease your risk.
Oh, good. Motivation to keep moving.
And sleep. Less sleep or disturbed sleep makes you more vulnerable.
Right. Makes sense. Your immune system needs rest.
Exactly. And let's bust a myth. Cold weather itself, it doesn't make you more susceptible. Studies in Antarctica kind of prove that. It's more about being indoors together when it's cold.
Ah, the proximity thing again?
Precisely. But some factors do increase the severity if you get infected. Things like underlying chronic diseases, certain immune deficiencies, malnutrition, and smoking,
Smoking definitely makes respiratory stuff worse.
without a doubt.
Okay, so let's talk symptoms. What does a cold actually feel like? We know the basics, but medically.
Well, first off, most of what you feel, that's your immune system reacting, not the virus directly causing damage.
Oh, interesting. So my body is causing the runny nose.
In large part, yes. It's part of the inflammatory response.
Yeah.
The most common symptoms are, you guessed it, rhinitis, the runny nose, and nasal congestion.
The stuffy nose, yeah.
That often sore throat, cough, and just feeling generally unwell, that malaise.
What about fever?
Uncommon in adults with the typical cold, more common in kids. Conjunctivitis red, icky eyes can happen in both.
And it varies a lot person to person, right?
Hugely. Depends on your age, your health, if you've had similar viruses before, and which specific virus it is.
What's the usual progression?
Often starts with that runny nose, stuffiness, maybe a scratchy throat. The cough usually develops a bit later, day 4 or 5 maybe, and that can linger.
Oh, the lingering cough. Yes.
Yeah, that can stick around. Lower respiratory signs like wheezing or crackles in the lungs, usually absent in adults with just a cold. Fever, if it happens, is usually low grade.
Other common complaints. Sneezing, headache.
Sneezing, definitely. Malaise, headache, sometimes pressure in the ears or face.
Okay, let's talk about the color, the nasal discharge. Does green or yellow mean bacterial infection?
The million-dollar question. No, not necessarily at all.
Really? But doctors sometimes ask about that.
They do, but clear or are purulent, meaning thick, colored discharge, can be perfectly normal during a viral cold. It's often just white blood cells doing their job. It does not automatically mean you need antibiotics.
That's a really important takeaway. How long does this whole thing usually last?
Incubation is quick, usually 24 to 72 hours. Maybe even just 10, 12 hours sometimes. The illness itself.
Yeah.
Typically 3 to 10 days in healthy adults.
But it can feel longer.
Oh, yeah. But 25% of people might have symptoms, especially cough, lingering for up to 2 weeks. Smokers often have it longer. The cough can sometimes persist for weeks afterwards.
Okay. And how is it diagnosed? Is it just obvious?
Pretty much.
Yeah.
It's based on your reported symptoms and what a clinician sees during a physical exam.
What do they look for?
Maybe some red eyes, swollen nasal passages, congestion, maybe a bit of redness in the throat. Lymph nodes usually aren't very swollen. Lungs should sound clear.
No need for x-rays or fancy tests.
Generally, no. Chest x-rays only if they suspect pneumonia or something lower down. Sinus x-rays or CTs, not helpful for a typical cold virus. Lots of healthy people have incidental findings on those anyway.
And viral tests or bacterial culture.
Also, generally not needed. We don't have specific antivirals for common cold viruses. And just finding a virus doesn't mean it's causing the current symptoms. People can shed viruses without being sick.
Right. Asymptomatic shedding.
Exactly. And bacterial culture is a nasal discharge.
Yeah.
Usually negative or just show normal bacteria. Plus, they take time and aren't cost-effective. Antibiotics only help if there's a specific secondary bacterial infection, which is rare with colds.
So rely on symptoms, mostly?
Honestly, yes. In rare cases, maybe a test called procalcitonin might help decide against antibiotics if the picture's confusing, but that's not routine.
Okay. So if it's not a cold, what else might it be? Just quickly.
Good point. Allergies, allergic rhinitis, often more sneezing, itching, watery eyes.
Okay.
Bacterial throat infection like strep, so usually a much more severe sore throat, often fever, less runny nose.
Got it.
Acute bacterial sinusitis can have similar nasal symptoms and facial pain, but it's separate diagnosis,
Yeah.
often develops after a cold.
Flu.
Influenza often hits harder, more fever, headache, body aches, fatigue, more abrupt onset usually.
Whooping cough.
Pertussis starts like a cold, but then develops into severe, prolonged coughing fits, sometimes with that characteristic whoop sound or vomiting. Definitely consider it if a severe cough lasts over 2 weeks.
And the elephant in the room, COVID-19.
Symptoms overlap significantly, unfortunately. Things that might point more towards COVID could be a known exposure, that distinct loss of smell or taste, or progressive shortness of breath. Testing makes sense if COVID is circulating widely, or if specific treatment would be considered.
Right. Makes sense. Can a simple cold actually lead to anything worse? Complications?
Usually no, it's self-limited, but sometimes yes. Acute rhinosinusitis, a sinus infection, can follow a cold, though it's usually viral, not bacterial initially.
Okay.
Lower respiratory tract disease is uncommon with typical cold viruses like rhinovirus, but RSV and parainfluenza can sometimes cause bronchitis or even pneumonia, especially in infants, the elderly, or immunocompromised people.
What about asthma?
Big link there. Upper respiratory infections, often rhinovirus, are a major trigger for asthma exacerbations in adults. The airway can remain hyperreactive for weeks after a cold. That might explain some lingering coughs, too.
Interesting. And ear infection.
Acute otitis media. Yeah, viral URIs can mess with eustachian tube function, leading to fluid buildup and infection. Viruses can even directly infect the middle ear. More common in kids, but adults get them too.
Wow. Okay, so even a simple cold isn't always so simple.
Exactly.
This has been really useful. I think that point about colored nasal discharge not automatically meaning bacterial infection is huge.
It really is a key thing to remember.
So summing up, the
Yeah.
common cold is complex. Tons of viruses cause it. Massive impact. Spreads easily, mainly through hands. Usually mild, but understanding it helps.
You got it. Even the everyday stuff is fascinating when you take a closer look.
Definitely. Which leads to a final thought for you to ponder. With all these viruses, over 200 types, constantly changing, what does the future hold? Is something like a universal cold vaccine even remotely possible? Something to think about. Thanks for tuning into this deep dive.